Polycystic ovary syndrome. What is polycystic ovary syndrome? Polycystic ovary syndrome, PCOS, is a hormonal condition that involves the circulation of too many androgens. Androgens are male hormones. PCOS is a condition that affects women's ovaries. It causes an abnormal number of cysts to appear on the surface of the ovaries. The cysts are follicles which contain undeveloped eggs. The condition often results in an irregular release of eggs. In some women, PCOS may prevent any eggs being released. Higher than normal level, or activity, of male hormones is also a relatively common feature of PCOS. It causes a distinct group of symptoms, including irregular periods and infertility. Doctors aren't sure what exactly causes it. But women who have PCOS have a higher risk of type 2 diabetes. PCOS is a treatable condition and a healthy lifestyle is a key part of this. Apart from hyperandrogenism, ovulatory dysfunction, it is associated with obesity, insulin resistance, and subfertility. Overall, insulin resistance and the compensatory hyperinsulinemia affect some 65 to 70% of women with PCOS. 70 to 80% of the women are obese, BMI above 30, and 20 to 25% of lean, BMI below 25. Part of the insulin resistance appears to be independent of obesity and related specifically to PCOS. Abnormalities of cellular mechanisms of insulin action and insulin receptor function have been documented. One, irregular menstrual cycles. PCOS causes irregular periods, fewer periods, or no periods at all. 2. Hair growth or hirsutism, growth of dark, coarse hair. Women may experience hair growth in places like the face, chin, or chest. 3. Hair thinning or hair loss, you might find that your hair loss mimics male pattern baldness. 4. Pelvic pain. 5. Infertility or problems in getting pregnant. 6. Weight gain or difficulty losing weight, some women with PCOS may also experience weight loss. 7. Acne on the chest, chin, back, or other areas of the face. 8. Also, skin darkening may occur, especially in creases like the armpits and groin. Depression and anxiety. 9. Depression or anxiety. About 50% of people with PCOS report mood changes. Unfortunately, that's not all. PCOS is associated with additional issues. 10. Other issues with PCOS include increased visceral fat, fat around organs, and subcutaneous fat, fat under the skin. 11. If you have PCOS, you may also be at risk for cardiac issues, high blood pressure, high cholesterol, impaired glucose tolerance. 12. Hyperinsulinemia, or excess levels of insulin, and, again, prediabetes or type 2 diabetes. 13. Dyslipidemia and increased evidence of inflammation are more common in women with PCOS. Many women demonstrate metabolic syndrome and elevated triglycerides, LDL and decreased HDL. How common is polycystic ovary syndrome? Diabetes UK states that PCOS is a common condition affecting about 1 in 5 women at some point in their lives. Estimates of PCOS prevalence vary widely.
9.
It's reported to affect anywhere from an estimated 2.2 to 26% of women worldwide. Some estimates indicate that it affects 6 to 12% of women of reproductive age in the United States. What are the 4 types of PCOS? The 4 types of PCOS include insulin-resistant PCOS. This is the most common type of PCOS, affecting around 70% of people. Post-pill PCOS. Post-pill PCOS occurs in some people after they stop taking the oral contraceptive pill. Adrenal PCOS. Inflammatory PCOS. How is PCOS diagnosed? The NHS states that the appearance of 2 or more of following 3 conditions can lead to a diagnosis of PCOS. 1. A number of cysts developing around the edge of the ovaries, polycystic ovaries. 2. Failure in ovulation, release of eggs. 3. A higher than normal levels of male hormones or more active male hormones than normal. Diagnosing of PCOS involves blood tests, blood pressure checks and ultrasound scans. NICE guidelines recommend that all women with PCOS receive a screening to assess their risk of type 2 diabetes. Yearly screening is recommended for women with a family history of type 2 diabetes. If obese, BMI of 30 kg/m2 or more, 25 kg/m2 or more if of Asian background. Women with gestational diabetes need to be tested. What causes PCOS? Insulin resistance and weight gain are two contributing factors to PCOS. Insulin resistance typically causes the body to produce more insulin than normal, hyperinsulinemia. Higher levels of insulin can then cause ovaries to produce too much testosterone. It can impair normal ovulation from occurring. Increased levels of insulin can also cause weight gain, which is associated with the development of both type 2 diabetes and PCOS. Despite being generally regarded as a male hormone, all women produce testosterone, albeit in lower quantities. In sum, a majority of women and adolescent girls with PCOS have insulin resistance and consequent hyperinsulinemia. The latter commonly leads to hyperandrogenemia with negative effects on reproductive function. Other possible associated factors for having PCOS include low-grade inflammation and hereditary factors. A 2018 study of mice has proposed that it's caused by excess exposure, in utero, to anti-mullerian hormone. Women who experience PCOS in young adulthood are at an elevated risk for diabetes and fatal heart problems, later in life. What does the research say about PCOS and diabetes? Researchers in Australia collected data from over 8,000 women. They found that those who had PCOS were 48.8 times more likely to develop type 2 diabetes than women who didn't. Obesity was an important risk factor. According to older research, up to approximately 27% of premenopausal women with type 2 diabetes also have PCOS. A 2017 study of Danish women found that those with PCOS were 4 times as likely to develop type 2 diabetes. Women with PCOS also tended to be diagnosed with diabetes 4 years earlier than women without PCOS. Australian study reveals, pregnant women with PCOS are 3 times as likely as women without it to develop gestational diabetes. Multiple studies have shown that PCOS and its symptoms are also frequently found in women with type 1 diabetes. Can I lower my risk for diabetes? Many studies have found that a higher body mass index, BMI, predicts whether a woman with PCOS gets type 2 diabetes. If you lose some weight, even just 5% of your total weight, you can improve your health and lower your diabetes risk. Getting more exercise is another powerful way to lower your chances for diabetes. What about other types of diabetes? Type 2 diabetes is much more common than type 1, in which the body doesn't make insulin or makes very little. People are usually diagnosed with type 1 when they're young, often as children or teens. Type 1 diabetes and PCOS. The link between type 1 and PCOS is clearer than with type 2. Type 1 seems to raise a woman's risk for PCOS. About 1 in 4 women with type 1 will get PCOS at some point. Women with PCOS can also get gestational diabetes during pregnancy. This condition makes your pregnancy more dangerous for you and your baby. It also can lead to type 2 diabetes later life for you and your child. If you have PCOS, your doctor will watch you closely for signs of gestational diabetes while you're pregnant. Treatment for PCOS. Treatments for PCOS can vary. Lifestyle changes will be recommended, particularly in overweight patients. Lifestyle changes help with reducing insulin levels. They are also useful in improving symptoms such as weight gain, hair growth and acne. Medication may also be prescribed to help with different symptoms. The type 2 diabetes medication metformin may be prescribed for some women but only if recommended by a specialist. Specific contractive pills or anti-androgen drugs may be advised if hormones are not correctly balanced. A low-carbohydrate lifestyle is effective for reducing insulin levels. This helps with weight loss and is likely to have additional benefits on other symptoms of PCOS. A research study, from 2013, compared a moderately low-carb diet with a standard low-fat diet. The results showed that the low-carb diet conclusively improved insulin, cholesterol and testosterone levels compared with the low-fat diet. Treatment for infertility due to PCOS. Fertility problems can also be treated by the following means: Clomiphene is a fertility medication that can help to induce ovulation. Laparoscopic ovarian drilling, LOD, is a surgical procedure that can restore ovulation. In vitro fertilization, IVF, may be required if the above are not successful or not appropriate. How is polycystic ovary syndrome, PCOS, treated naturally? Natural treatments for PCOS can improve many PCOS symptoms for some. Others may need PCOS medication to help manage certain related risks. Eating wisely, being physically active, sleeping well and reducing stress can help reverse the hormone imbalances. Research shows that managing your weight, even shedding a small percentage of your abdominal fat helps. Irregular periods and infertility. Exercising regularly can improve symptoms such as irregular periods and infertility. They will improve the effectiveness of medications for your glucose level and improve insulin resistance. Nurturing your health with smart daily choices also helps protect against heart disease and diabetes. A healthy diet plus exercise and stress reduction are also proven to help lift anxiety and depression. They will also improve sleep, reduce fatigue and boost energy, additional pluses that can help you feel great. Wise food choices and more activity might reverse some symptoms of polycystic ovary syndrome. What are the currently recommended medications? For some, lifestyle changes may be all you need to control the symptoms of your PCOS. But for many other women, medications may be necessary to help control harder to manage symptoms such as fertility and other major risk factors like insulin resistance that leads to diabetes and high blood cholesterol. Commonly prescribed medications include combination birth control pills. Oral contraceptives containing estrogen plus progestin help you manage PCOS by normalizing your menstrual cycle. By reducing levels of male hormones, OCs can help control excess hair growth and acne, too. Women usually shed the lining of their uterus every 28 days while taking an oral contraceptive. It will also reduces their risk for endometrial cancer. Oral contraceptive pills are sometimes prescribed for women before they begin fertility treatment, because these female hormones reduce the male androgen levels. But it's important to know that they won't help restore ovulation. Insulin sensitizing drugs, a particular medication, called metformin, is usually prescribed. Another medication, pioglitazone, may also be suggested for women with PCOS. These two medications are FDA approved for diabetes treatment. But plenty of research shows that they can be equally effective for women with PCOS, too. These insulin-sensitizing medications can help your body respond more readily to insulin, and better control your glucose levels. Metformin and pioglitazone can reduce the insulin resistance and high insulin levels that commonly occur with PCOS, and in turn, can reduce high androgen levels. As a result, these anti-diabetes medications may improve ovulation and help make menstrual periods more regular. But this process can take 4 to 6 months. Also, while these medications can work well for some women, these medications don't help every woman. For women taking metformin or pioglitazone, the American College of Obstetricians and Gynecologists has a warning. Insulin sensitizing agent. Women who start insulin sensitizing agents should consider using birth control pills if they don't want to become pregnant. The reason: women who take these medications may start ovulating again. By reducing the high levels of androgens, these medications can also help take care of acne, excess hair growth, hair loss at the scalp, may promote easier weight loss, reduce high cholesterol levels, and reduce the risk for heart disease. Fertility treatments, once other possible reasons for infertility in you and your partner have been ruled out. Your gynecologist or fertility specialist may recommend the drug clomiphene, Clomid, to induce ovulation. 6 months of treatment has been known to achieve successful pregnancies for about 20 to 40% of women with PCOS. If clomiphene is tried and isn't effective, you may be given gonadotropins to try and jumpstart your ovaries. If these standard treatments don't work, your doctor may recommend in vitro fertilization, IVF. Your egg is fertilized by your partner's sperm in a lab, then transferred to your uterus to implant and grow. Your doctor may also recommend a surgical procedure called ovarian drilling, lasers, or a very thin heated needle, are used to pierce several holes in the surface of your ovary. It improves the chances of successful ovulation for about 6 to 8 months. This is specifically effective for women with PCOS, since their outer surface of the ovaries can become extra thick, interfering with the natural process of ovulation, removing or slowing the growth of excess hair. Shaving, bleaching, plucking, waxing, and applying over-the-counter hair removal creams are effective, albeit temporary. For permanent results, you might try laser hair removal or electrolysis, but these are expensive. They require repeated treatments, and are not guaranteed to be successful. The prescription cream eflornithine hydrochloride can slow the growth of new hair when applied as directed on the face and other areas. But it won't remove existing hair. Your doctor may also prescribe a medication called an anti-androgen. In the United States, spironolactone, and in other countries, cyproterone are used to slow new hair growth. As many anti-androgens appear to cause birth defects, you may be recommended taking birth control pills at the same time. Acne, above birth control pills, anti-androgen drugs and insulin sensitizing drugs, can control severe acne. Additional acne medications are recommended to unclog pores, control skin bacteria and soothe inflammation. These may include retinoids, antibiotics, and products to help unclog pores. One warning: retinoids can cause birth defects and cannot be used if you are already pregnant or are planning to become.